We know patients with obesity have a higher risk of course, heart disease, arrhythmias, sleep apnea, high blood pressure, diabetes, high cholesterol, but also cancers. Previously, and Jamie knows, I'm a huge nutrition shill. I'm the first person to emphasize diet and lifestyle change. But one of the things I also am very cognizant of is that obesity is incredibly complex. This is a multifactorial disease, and it is not just a matter of willpower. The idea, that years ago we used to say just eat less and exercise more is so outdated because we've now realized with the metabolic research over the last decade and 2 decades that it's so much more complex than that. And so now, back in the day, we used to just tell patients, we'll try to go on this diet plan and this exercise plan and good luck. But when you look at all the randomized controlled trials with intensive lifestyle interventions, they all have the same result, which is that people always, lose some weight, 2 to 5 kilograms by 6 months, by a year, and then by 2 years, there's regression to the mean. And that's because obesity is so incredibly complex, influenced by a multitude of variables, genetic, environment, socioeconomic, all of these different food environment, all these different factors. And now we have medical therapy that can subsequently really treat it adequately with diet and lifestyle and exercise, like GLP-1s like tirzepatide, which have trials for sleep apnea.
Right. And they were just approved for
Surmount. Yeah. So Zepbound
Mhm.
was FDA approved for sleep apnea. And so this is in people with obesity. So Zepbound is a GLP-1 GIP agonist. These are a dual incretin agonist, which means we have incretin hormones. These are hormones that affect the GI tract, but really where we think these are predominantly working is in the brain, the hypothalamus of the brain. And through diet exercise with the GLP-1 like Zepbound on board, they did a randomized control trial called the Surmount trial, and they found that individuals that had a BMI greater than 27 with sleep apnea ended up having significant improvement. And actually, in the initial Zepbound trials, they found that people had lost up to 25% of their body weight at the 2 year mark, which is astronomical. No diet trial can even compare to that. They've actually found that now it improves sleep apnea so drastically. So, yes, it received FDA approval for obstructive sleep apnea for individuals with a BMI greater than 27. And so this is really like the perfect intersection that we have in our specialties because it really is all combined. It goes to show you that our organs don't exist in isolation.
Right. They do not. Our cells in our bodies are constantly communicating with one another. They do this with cytokines and chemokines, and they're telling each cell what to do as a result of what their environment is giving them. And you guys always know what I say. I always say that disease is your immune system's response to the environment. Disease is as a result of cell communication. And so when Danielle is saying things, talking about nutrition, what she's talking about is really obtaining the molecules that your body needs to function optimally. Like we're talking about these molecules that are evident in the produce section of the grocery store, right? That's what we're talking about is those coenzymes or vitamins that are within those foods that allow your organs to function very, very well. The less time or the less of that kind of food that you're bringing in, because you heard her say plant-based earlier, the more likely you're bringing in glucose, and glucose can lead to significant weight gain.
Well, glucose itself is,
Yeah.
is okay. It's just it's what it's packaged with. This is one of the great examples why, being a physician in California, I'm sure you see the same thing. We're in a specific area where in Southern California where oftentimes supplements are, all over the place. Even in our ASPC clinical practice statement on nutrition, it was the first time in a cardiology statement for nutrition and cardiovascular disease prevention. When I became the lead author, I said, I really want to add a supplement section because there's so much confusion about supplements. And essentially what we added was that there's absolutely no supplements that actually reduce cardiovascular risk. You actually want to eat the food. So, you want to eat the fresh fruits and vegetables and get your vitamins and minerals and polyphenols from these fresh fruits and vegetables. And you don't have to go completely plant-based. And actually, there's a tremendous amount of data that there's a wide variety of dietary patterns that are beneficial. Mediterranean diet, fatty fish is phenomenal. Eating a DASH diet. There's so many different dietary patterns. You can even do, any sort of kind of combination of the above. The reason why these GLP-1 medications tied into diet make such a difference is, pretty much when every patient with obesity comes to see me, and the reason why I refer Jamie so many patients with sleep apnea is because I do a lot of cardiometabolic health and weight loss in my practice. And a lot of patients with obesity have sleep apnea. Previously, before we had the advent of GLP-1 medications as an option, by the time a patient comes to see me, they know what to eat. They know they should be eating a healthy Mediterranean diet. They know they should be exercising. And a lot of patients are doing that. But weight loss can be incredibly difficult. And so, what these medications have done is that they've helped to change the metabolic milieu that patients, see and implement those dietary changes. Eat that Mediterranean diet that's going to be anti inflammatory and having tons of benefits for both not just heart disease prevention, but also cancer risk reduction and all of those things. So, it's really incredibly beneficial. And specifically, I find it most interesting. There are, and this is one thing I wanted to pick your brain about, if you don't mind me like going off course a little bit.
Let's
But
do it. Yeah.
when I have patients with obesity who have sleep apnea and then they lose weight and they get to their goal weight, and they still have sleep apnea, and I send them back to you. My question is, does that mean that it's more of an anatomical sleep apnea? And how do patients kind of understand that topic? Because sometimes they think it's only related to obesity. And I try to explain that, well, actually, no, you can be a normal BMI and have sleep apnea as well.
Yeah. When you look at those particular patients, I mean, the first question that you would have to say is, okay, we know this patient lost a significant amount of weight. Is their BMI under 25?
Yeah, correct.
All
That's
right.
what I mean. Yeah,
That's it.
that's
So if their BMI is under 25, there are certain things that you want to look at. You look at their sleep study, you look at their in lab sleep
yeah.
study. Is there any evidence of central sleep apnea?
Mm,
You look at their anatomy in their airway.
right.
Is there any evidence that the muscles within their pharynx are just relaxing when they're not supposed
Right.
to? And then you have to ask yourself, does an oral appliance help these individuals? Now, we were talking earlier about this, and we have some doctors just like, oh, just you don't need anything else, just go get this oral appliance. All of these therapies for sleep apnea can be used together.
Mm,
It's not just about the mainstay of therapy, which is what we call continuous positive airway pressure, which is a machine and a mask that you can put over your mouth, over your nose, or over both that gives you positive pressure.
mhm.
And what it's supposed to do is keep the airway popped open so that way it doesn't obstruct and air or oxygen can get into your lung and everything is all good and everything is kosher. You don't get those arousals at night. You don't get that elevation in blood pressure at night, and you don't have that elevation in blood pressure during the day. When you look at sleep apnea as a whole, there's a number of things that can take place. You can have arousal differences. So people, for some strange reason, just get up, right? And they just wake up, and that increases their blood pressure at night, will give them a higher blood pressure during the day. You can have many different things happen within your upper airway and that first half of your lower airway that are obstructing the airway. So you really want to understand that anatomy. There are instances where people have had strokes and their brain stem and their chemoreceptors, what actually induces them to take that breath kind of changes. It's not as sensitive under normal circumstances. The level of carbon dioxide within your bloodstream is what tells you to breathe or not, but sometimes that can get reset. So there's a number of different parameters or different things that can contribute to your sleep apnea. It's not just all obstructive sleep apnea and just the airway obstructing. There's a lot more to it than just that. And so when people ask me that question and they're like, doc, my BMI is 22 and I got sleep apnea, why do I have it? These are the things that come to mind. Now, these aren't things that are easily treated, right? It's not just about the CPAP, right? There are certain medications that you can try. None of the medications except tirzepatide are actually FDA approved for sleep apnea, but the medications are effective at doing what we think is going on to that patient, right? At counteracting that. And so these are all things that a sleep specialist would look into and would know, be able to discuss with their patient and prescribe. I'm not going to sit here and give you every single little thing that can go. I think that that would be a little bit too much for the podcast. However, we have to understand that appropriate sleep specialists we'll apply that information and we'll make certain that they cover all of that, which is when we get scared of certain specialties kind of diving into sleep medicine a little bit because do they think about all of those things,
Right.
right? So that's what yeah.
That's a great point. And I will say that, one thing for tirzepatide and for the weight loss that's pretty magical is similarly, the vast majority of the patients phenomenally do see remission of their sleep apnea once they lose, I had a patient recently that lost 168 pounds on Zepbound and now he's at, 180 and his sleep apnea, I sent for a repeat sleep study, it's gone, which is, amazing. And so I think that you're right. It's important to keep in mind that we do have treatments for each different kind and subset, but I think finding out the kind you have and going to the right specialist who's going to be able to triage that appropriately is the most important step.